Hello, hello, welcome. Welcome, welcome, welcome. Oh, I think I need to. Okay, let me see if I need to go over to. Um, Hold on. All right. Hey, y'all. So, I'm excited about this. So, this is like my first time going live on YouTube, and I am trying all these different platforms out. So I'm live on Facebook, I'm live on YouTube, and I'm live on Instagram. So I'm excited about this. I think I want to share it out though. So let me go on real quick to share this to my other page on Facebook. Um, yeah, so it is already live. Okay, so I'm gonna share it again. Let me share it. Um, oh no, I'm trying to share it. Let's see. Mm, I don't know. Anyway, hey y'all. I am really glad about this conversation tonight. So normally on Thursday nights I do Thursday night purpose talk, and Thursday night purpose talk is about just like the purpose journey and kind of what's needed from you as you are trying to fulfill purpose or actually trying to position yourself. So I talk about different topics, different things like that. But tonight, I want to talk about something for my 40 and over crew, possibly even like the 35-year-old crew. And the reason why is because like this situation or this issue is becoming more of an issue in younger women. And so I think like even as early as like 35 years old, I think is an age where we start to kind of tune in and hone in on some of these same issues. So tonight I want to talk about hormones and menopause, and just kind of share a little bit about like my story as where that's concerned, and then kind of just like fill you in on um just some of the things that I've experienced, and then kind of like have you thinking about things that you might not typically think about when you think about menopause or when you think about hormones. And so that's what we're going to talk about tonight. And it's so interesting because one of the reasons why I decided to talk about this particular topic of hormones and menopause is because I see a lot of like my social media people around my age. I'm 50, but around my age, kind of bringing light to some of the things that they're dealing with in that area. And so I was like, over the last probably 3 years, I have done a lot of personal research where menopause is concerned. I've done a lot of listening to lectures, listening to podcasts, reading books. I have a functional medicine team in place. I have a hormonal gynecologist in place because of hormone replacement therapy that I have committed myself to. And so there's a lot of different elements that I have in place that has allowed me to gain like more of a perspective on this menopausal journey and kind of the way that I had to go into menopause. So my experience with menopause wasn't like an organic progression or like an organic kind of ease into menopause. My experience with menopause was somebody like balled me up like a ball and went back like this and tossed me into menopause. Like one day I wasn't in menopause and the next day I was in menopause. And that's because I had surgery back when I was 40. So this year would be 10 years that I've actually been in what's considered to be post menopause or menopause. And so if you have not been in that space or you don't really know what that's about, kind of zone in on what I'm talking about. Because if you are at that age of like 40 years old or between 40 and 45 or even 40 and 50, it's possible that you're having like some symptoms of menopause. And so let me just say there's a whole lot of information when you start looking for information on menopause. There's a ton of information on perimenopause. And so everybody's talking about perimenopause, which is the precursor to the actual menopausal experience, right? So you're always going to find information on perimenopause. If you just go and type in perimenopause, it's probably going to lead you to podcasts, it's going to lead you to lectures, it's going to lead you to books, content, everything, because everybody focuses their attention on perimenopause. But the demographic that does not get a lot of attention is the demographic that's in the menopausal space. And it's my belief that that's like that because a lot of people really don't know what to do with the menopausal people. Like they don't know what to do with us, right? Because we're not perimenopause anymore. So there's not those types of treatments that can be given to perimenopause people, that are given to perimenopausal people, but you don't give them to menopausal people because perimenopause still means that you are still functioning. You may actually still have your period. You may actually still have all of the dynamics functioning the way it should be functioning, but your hormones are starting to go in a declination period. And so you kind of see like yourself responding maybe with hot flashes or with night sweats, or you might see yourself experiencing weight gain, or you might see yourself experiencing anxiety or depression, or you may even start seeing yourself like experiencing some of these other most common symptoms. But there are other symptoms that you probably have not experienced, and you might not experience until you like get into that full-on menopausal space. But even in the perimenopause space, there's still going to be some experiences that you're going to experience like as precursors. So I'll just start like with a little bit of my story. So I mentioned earlier that I am 50 years old, and I had surgery. So I have stage 4 endometriosis. And if you're not familiar with endometriosis, definitely look that up. It's a very common disease, very common condition that probably 1 out of 8 women are suffering with or struggling with even now. And it's a very painful condition. And so for a lot of people, because of what endometriosis does inside the body, a lot of women will experience, unfortunately, um, infertility because they're not able to release eggs, or their fallopian tubes may be scarred up. So they're not able to have that whole system of an egg being released. Or there may be scar tissue over like certain reproductive organs, just whatever might be in place that's going to hinder the reproductive process is not happening in those women who have endometriosis, in some of those women who have endometriosis. So I was one of those women who experienced that, unfortunately. And so I was diagnosed with endometriosis right around 29 years old. And it took me 14 years to get diagnosed with endometriosis. So I started having symptoms at around age 15. I was in high school, and I didn't get diagnosed until 29 years old, which is pretty common with that. You'll find a lot of women who don't get diagnosed because it's not a simple process to get diagnosed with endometriosis. But a lot of the symptoms of endometriosis is, heavy cramping, heavy bleeding, um, cysts or blood clots, or just different things. And so I have stage 4 endometriosis. It's like a cancer stage. So you have stage 1 all the way up to stage 4. And a higher stage doesn't necessarily dictate more pain. For me, it did. But for some women, they can be in stage 4 and not have as much pain as another person, another woman who's in stage 4. So I did have stage 4 endometriosis. It was very painful for me. It did end in infertility. I had a total of 8 surgeries. And at the age of 40, 10 years ago, I had a total hysterectomy, a complete hysterectomy, along with a oophorectomy. And there's another like medical terminology for this, but I have fallopian tubes removed as well. So a complete hysterectomy with an oophorectomy, which means that all of my ovaries were both of my ovaries were removed as well. So at that time, it took me a long time to make that decision to actually have the hysterectomy. It actually took me several years, a move. I had moved to North Florida from Central Florida. And so it took me several years, prayers, experiences, to make the decision of whether or not I was going to have that surgery. But when I did decide to have that surgery, trust and believe it was a well thought out decision. I had a conversation with my doctor at the time. My doctor, my OBGYN, told me everything that she knew to tell me, right? And so that's very important, as I mentioned this, because a lot of people get upset with their doctors when their doctors don't tell them everything. But what I had to eventually understand and embrace was that my OBGYN at the time, this was back in 2014, my OBGYN at the time told me everything that she knew to tell me, right? And so I asked her a ton of questions about what does this mean? What how am I going to feel from this? Is this going to change the dynamic of my body at all if I decide to get this surgery? What does having a hysterectomy mean for me? What does having my ovaries removed for me mean for me? What does having my fallopian tubes removed mean for me? And so I was asking her these questions, and she was answering the questions to the best of her ability. So here's the thing that kind of gets people upset, because they make their decisions based off of what the doctor tells them. And so at that time, even though it took me several years to make the decision about having the hysterectomy, and it took me a number of years to make the decision about having the surgery. This was surgery number 7, because even after I had the hysterectomy, I still had to have another surgery, but I'll talk about that. That was 3 years later. So by this time of me making the decision to have the hysterectomy, I still had already had a total of 6 surgeries. And so you can understand why I was asking my doctor these questions. And I said, okay, well, what does it mean for this? And so she gave me her answers based off of how she could answer the question. And so I decided to have the surgery. Remember, this is back in 2014. I decided to have the surgery because when I tell you, having stage 4 endometriosis for me was absolutely horrible. I mean, I'm talking about from the time I can remember, I had extremely painful periods. I had extremely painful cramping. I could not, there are 4 weeks in a month on average. And for 3 weeks out of the month, I could not function. I had to go to work. I was working for the United States Postal Service, and I had a very active job. So I had to go to work, but I couldn't work out. I couldn't exercise for 3 of those 4 weeks because the pain, my body, my joints. I remember distinctly my hips being so painful, my joints being so painful. When I tried to sit down on the floor, it would take me like 20 seconds just to sit down on the floor because I had to maneuver my body in order to sit down in a spot that would not further make my hips and my joints painful. And so I had gone through that for a number of years. I got married when I was 23 years old, and me and my husband at the time had made the decision that we were going to wait 5 years. You know, when you get married, you make these decisions. I'm going to wait for a few years before we had kids because I hadn't been diagnosed with endometriosis yet. So I didn't know that that was what I had. So he and I were making these plans to be able to have children, and it wasn't what prompted the diagnosis of endometriosis was we were trying to get pregnant and I couldn't get pregnant. And so I had like these two, they're called endometriomas, which are like pockets of blood in the crease, right, of my leg. And that's where I got diagnosed. I actually, and it was so interesting. My OBGYN at the time did not know to diagnose me with endometriosis. She had no idea. So I had to be sent to a general surgeon. I will never forget this doctor's name, Dr. Thompson. He was my general surgeon to remove the endometriomas, but we didn't know that they were endometriomas at that time. And so I went to have the surgery for the first one because I only had one at the time. And he said, "Have you ever been diagnosed with endometriosis?" And I said, "No." I said, "But my mother has it." So I knew that my mother had endometriosis. She had to have a hysterectomy immediately after she gave birth to me. So I knew the history of endometriosis, but I didn't realize that endometriosis was borderline genetic. And so it wasn't the first thought that came in my mind that I possibly have endometriosis. So immediately when he went in to remove the mass that he saw, he immediately said, "You have an endometrioma." He said, "And I'm willing to bet that you have endometriosis." And so he sent those notes over to my doctor. And that was, I ended up having a laparoscopy, which is the formalized process to see if you have endometriosis. And that's when I was officially diagnosed with endometriosis. So, fast forward, as I was speaking about earlier, I did decide to have the hysterectomy in 2014, had the hysterectomy, had the oophorectomy. And I thought, now my doctor never told me that life was going to be beautiful, but she did tell me that I would feel better, right? Because I wasn't going to have a period anymore. I wasn't going to have to deal with this joint pain anymore, which was a byproduct of having endometriosis and having scar tissue and different lesions all over my body on the inside. So I was happy about that, right? So when you're thinking about whether or not you're going to have a surgery of some kind, you're probably thinking about the elimination of the pain factor that you're dealing with when you are whatever that surgery is going to correct. And so when I decided to have the hysterectomy, when I decided to have the complete and so I asked her, I said, "Well, do I need a total hysterectomy or can I get away with a partial hysterectomy?" And we knew that one of my ovaries was bad. And I had never, so this was back in 2014, so 10 years ago. And that's why we're talking about hormones and menopause, because we didn't know a lot of the stuff that we know now. And a lot of doctors we didn't have like the frequency of the internet. We didn't have the huge platforms of social media now. We always had YouTube, but nobody knew what to Google, right? Or what to search for on YouTube, or what to Google for on the internet. And so those types of questions weren't posed, they weren't asked. And so, I'm just thinking, okay, I gave a lot of thought to this. I gave a lot of prayer. I had a lot of prayer. I talked to God and I talked to my mom, and I was divorced by this time. I wasn't married anymore. So I made the decision to have it. And I said, okay, well, it's great for me to just get rid of what I'm dealing with the cramping and all of that stuff in the period. So for 5 years after that, so I had the hysterectomy at age 40, 45, from 40 to 45, I was doing fairly well. 3 years later, in 2017, I told you I had to have another surgery. That was because there was a little piece of ovary that was still left, because my doctor, there was a lot of chaos, right, internally. And so they tried to do the best surgery that they could to remove everything, but they weren't able to remove everything. And so I ended up having a piece of ovary that was left, and that sparked me to have another robotic surgery in 2017. So 3 years later, and I finally was able to get all of this removed. So from 40 to 45, I was doing fine. I was still living in Florida. I was still working out. My weight was managed very well. I was in probably the best shape of my life. And I was like, oh, this is pretty cool. Like, I made the right decision. Everything is good. Everything is fine. And so then I moved to Chicago. So I live in Chicago now. I moved to Chicago. Here's where it started going a little crazy, because what I didn't realize when I moved, and this is where I really need for you all to kind of like lean in and listen to what I'm talking about right now, because this is where I'm going to start talking about the different experiences of menopause and hormonal declination, and what my body started receiving and what my body started sending, because of the environmental change. And so these are things that I did not know. So one of the conversations that I never had with my doctor when I made the decision to have a hysterectomy was I never had the conversation of menopause with my doctor. My doctor never told me that when I have this surgery, my body is going to go into a surgical menopause. She never told me that, right? And your body doesn't go into a surgical menopause unless you have your ovaries removed. If you have a partial hysterectomy where your ovaries are there, you're not in surgical menopause, because menopause means that you're no longer having a period, right? But it also has to do with hormones that are not being produced anymore. And so when I didn't have my ovaries anymore, I wasn't producing any more hormones. So we have testosterone, we have estrogen, and we have progesterone, which are our main hormones that we produce in our bodies as women. We have a number of other hormones in our body. Vitamin D is a hormone, insulin is a hormone. We have a number of different hormones in our body, but the major hormones that we often hear about is testosterone, estrogen, and progesterone. And those three hormones are produced in the ovaries of a woman. So when you have a hysterectomy with your ovaries removed, you are now automatically in surgical induced menopause. And so when I had my ovaries removed, I never had my doctor never mentioned to me that you are going to be put in a surgical menopause. So I had not had that connection made at all, right? And so when I moved, so there was no reason for me to do any research. There was no reason for me to do anything at that time, because that was not a conversation that we had. So here we are, fast forward 5 years after I've had this surgery. I'm now 45 years old. I moved from Florida to Chicago. And Chicago and Florida, let's say Chicago, Illinois, and small town Florida, I was living in Tallahassee. I'm a native Floridian, so I've always been brought up in the sun. I've always had very clean air. You know, the ocean is there, and so the air is cleaner. My hair never dried out. My hair was always very oil based and oily and moist. I never had the problems that I started having when I moved to Chicago. And I still had not put two and two together as to why that was happening. And so what I noticed when I moved to Chicago, almost instantly. So from 40, I just turned 50 last year. So for the last 5 years, I've been going on this emotional and physical and mental health roller coaster since being in Chicago. And so what started happening in my body was I started gaining weight when I got here. I started experiencing large amounts of anxiety and depression. My blood sugar numbers started increasing. I had never ever had an issue with my blood sugar. I've never been diagnosed as diabetic or pre-diabetic ever. As a matter of fact, I just told you that after I had the surgery, for like the first 4 or 5 years, I was in the best shape of my life, the best health of my life. I typically work out 4 to 5 days a week. And my diet was borderline good, right? It wasn't perfect. It wasn't 100% clean, but my diet, I've always been cognizant of my diet. And so when I moved to Chicago, all of these things, like I'm telling you, like it hit me like a Mack truck. One day I was doing okay, and then it seemed like the very next day I put on 50 pounds. Um, I'm sitting down talking to a therapist and a counselor at the VA. I am, my blood sugar goes up. I'm now diagnosed as a pre-diabetic. My blood pressure, sometimes it's super high, sometimes it's not. My allergies are going crazy. I'm now put on 3 allergy shots a week. My feet, my joints started hurting really bad. I got plantar fasciitis in my feet. I found myself wearing sneakers all the time with my work clothes. All of this stuff was happening to me. And I was like, what in the world is going on with my body? And I was depressed. I was going through a lot of anxiety. And I told my mother, oh, insulin. So I told you earlier, insulin is a hormone, right? But my insulin, obviously, with the A1C being higher and me being diagnosed as pre diabetic, the insulin, my mom reached out to me. She said, I think that you need to check out insulin resistance. And I said, well, what is that? She said, I don't know what it is. I just saw something, and a lot of what they were talking about reminded me of you. And so I said, okay, so I tucked insulin resistance in the back of my mind because I'm still not really understanding what's going on with my body. I'm like, 3 years ago, I was fine. Why now all of a sudden I'm having all of these things that's wrong with me? I'm telling you, my muscles were sore, my joints were hurting, I couldn't walk well. Like I said, I gained 50 pounds. My insulin went high. Cholesterol wasn't really a problem, but it could have been a problem. Blood pressure was vacillating. It was going up, it was going down. Allergies were being affected. My hair started thinning. Oh my God, so bad. Um, this is my second set of locks. I've always had sister locks. I had sister locks since 2007. And I had about 711 locks when I first had my first set of sister locks. When I moved to Chicago in 2017, I had my I cut them out because I didn't want to deal with, trying to find somebody new in Chicago. And I decided to just do like natural for 3 years. So I decided to get my sister locks back in 2000 and when was it? 2021? I think it was 2021. I decided to get sister locks back. And when I went back home to get my sister locks installed, my my sister locks consultant said to me, she said, I have no idea how the women who did your hair before were able to put over 700 locks in your hair. They were like, in your head, they were like, there's no way, there's no way. They're like, we've put the maximum amount of locks that can be in your head based on the size of your head, based on the density of your hair, based on everything. And I couldn't understand at that time, but I later understood how that was like 13 years prior. And I said to myself, well, I am 13 years older and I am in menopause, and hair thinning is a big deal. And I don't have the same density of hair. I don't have the same number of strands of hair that I had before. So that's probably why, but I did not realize. So the difference in hair now, like I have 450 locks, I've lost some more locks, but around the perimeter, the side and the back, but I've lost locks because of hair thinning, right? So hair thinning is another symptom that I saw myself getting. So I'm thinking to myself, what in the world is going on? I do not understand why my body is experiencing all of this different turmoil. What is the problem? And so, because I'm an educator by trade, I love to learn. I immediately start going to figure things out. I start going to research things. I start going to the internet. I start looking up lectures. I start listening for podcasts. I start reading books. Thank God, I have a really good friend of mine who put me in contact with a functional medicine doctor. I looked up what a functional medicine doctor does, and I said, okay, this is somebody that I probably need, because what I needed to do was I kept telling my mother, there's something going on the inside of my body. I can't put my finger on it, but there's something that I had not been able to lose a pound in 3 years. probably 3.5 years. And I was working out. My diet, my nutrition was, I would say, probably 75% good. I was not able to lose a pound. In fact, I was gaining weight and not losing weight. I told my mom, I said, this is not my MO. This is not how my body functions. Something on the inside of my body is wrong. Something is going on. And she said, you know your body. She said, you're probably right. She said, so don't stop until you figure it out. My mom used to always tell me one thing about you: you are not going to sit on your feet when it comes to your health. You are always going to figure out what's going on with your body. And so that's when I started being committed to finding out what was wrong. And I started doing these, I started listening to all of this information, and that's when I started learning about the effects of hormone declination, menopause, what it means, the difference between someone going into menopause organically, perimenopause, and then menopause, and someone going into menopause immediately, right? So, something that is very important is if you have your ovaries, right? And your body is just gradually, like, just because of time and age, right? You're 44 years old, and naturally, the natural progression of life is your hormones are going to start declining. Whatever you were at the top of your hormonal levels at probably 25, 27 years old, now at 44, you're not at the same height of level, right? So your hormones are definitely declining. What will happen, and this is what I've seen. I was literally just having a conversation with a friend a couple of weeks ago, and we were at brunch, and she said, girl, she said, I'm gonna have to do something because I went to the doctor and the doctor said that I am pre-diabetic. Now, remember, I told you a few minutes ago how that was one of the things that started happening to me when I realized I was in menopause, not premenopause. I was in menopause because I don't have any ovaries. So I was totally in menopause. So my friend was telling me that, and this is like 3 years have gone by. So I've done a ton of research. I've done a ton of reading. I've done a ton of listening. I've seen my functional medicine doctor. I've had my hormones tested. I've done all the blood work, all this stuff. So I told her, I said, girl, I said, let's have a conversation. I said, first of all, I said, what are you, 44, 45? She said, I'm 44. I said, you're in perimenopause. I said, and one of the, I don't even know if I want to say symptoms of perimenopause, but for lack of a better word, I'm going to say one of the symptoms of perimenopause that a lot of times we don't naturally default to is, or we don't naturally think about, is the health of our body starts declining because our hormones are declining. And it's really important for us to realize that the dynamic of a woman's body, we were created to function off of our hormones, right? That's just the way that God created us. And so when your body for years has had the balancing and the regular functioning of your hormones, your estrogen has been on point, your testosterone has been on point, your progesterone has been on point, maybe your insulin has been on point, everything has been on point, right? But when you get into perimenopause and or menopause, those hormonal elements are now starting to decline. Your body is not it's not leaning into what was helping it to function all of these years. And so when it doesn't have that source to help it function, it's going to start going awry, right? And so we don't realize, I'm telling you, this is one of the things that we don't realize. We don't naturally default to when if we know that we've lived somewhat of a healthy life. We know that we don't eat overly bad. We know that we don't eat have a lot of cholesterol in our diet. We know that we don't eat a lot of fried foods. We know that we exercise. We know that we do all the things. But still, when we go to the doctor right around that 44 year of age, that 43 year of age, that 40 year of age, and we start getting these results from testing that says that we're now high blood pressure and we're now pre-diabetic, and we now have this, that, and the other. We now have bad joints, and we now have degenerative conditions in our joints and in our bones. We don't naturally default to, oh, maybe I should get my hormone levels checked. We don't naturally default to that because our brains are not tied to understanding or having that sense of knowing that our hormones are literally the reason why we function like we do as women, right? And so when those hormones are now not where they used to be, our bodies are going to start responding to that in a bad way. If you do research on anything and ask the question, is hormone declination tied to um, bone and joint pain, to excessive mid waist weight gain? Um, is it tied to anxiety? Is it tied to depression? Is it tied to hair loss? Is it tied to cholesterol, high cholesterol? Is it tied to high blood pressure? You're going to find the answer being yes, right? And so I think part of what we have to do as women is we have to become aware of our bodies. If there's one thing that I could tell a 20, like a young woman in her 20s, her mid 20s, where her hormones are at the height, the one thing that I would tell her is you should be getting your hormones tested every single year. Get your hormones tested annually and keep a running tab of what your hormones look like at the height of your existence. And the reason why I would do that and say that is because as they matriculate through life and as that 25-year-old gets to be 30 and as that 30-year-old becomes 35 and that 35-year-old becomes 40, those hormones are going to start declining, right? The estrogen is going to start declining. It's just the natural progression of life. The testosterone is going to start declining. And the first thing that they're going to read, or the first thing that they're going to hear, which is the first thing that we hear and the first thing that we read all the time, is, oh, you need to balance your hormones. Well, the follow-up question to that is, balance them to what? What am I balancing? Here's the thing. The first question, what am I balancing them to? And the second question, what's the barometer of the balance? Right? Because my balance is not the same as your balance. So if my hormones need to be balanced, then it's going to be balanced based on what my body's optimal rate for functioning is, as opposed to what the next woman's body's optimal rate of functioning is. And so to put out a blanket statement of we need to balance our hormones, we don't have anything to balance them to, right? And so when a woman in her mid 20s is getting her hormone levels checked by blood work every single year, and she's keeping a running tab of what that is, when she becomes 35 and 40 and she starts experiencing perimenopause, she's going to be able to pull out that journal or that book and she's going to be able to tell her doctor, well, this is what my hormones were. This is what my hormones were for my body at 28 years old. This is where I need to try to balance it to, right? If my hormones are at, are the height of it for my testosterone was at 150, right? And then by the time you're at 40, it's down to 90. Then that means that you need to, whether it's with exercise, whether it's with food, whether it's with whatever, you know that when you get to 160, when they run your blood work, after you put in whatever types of plan that you're putting in to balance your hormones, when it gets to 160, then you can be like, okay, we've reached where we need to be. My hormones are now balanced. But when you don't have that frame of reference for balancing, it makes it very difficult to know what balancing looks like for you. Here's the other side to that. The other side is we always, I can't tell you the number of times that I have heard You need to balance your hormones. Your hormones are imbalanced. And while that may be true, 99.9% of the time, yeah, our hormones are imbalanced because as we get older, your hormones are going to naturally imbalance, right? They're going to be out of balance. Your hormones are probably going to be out of balance when you're younger, depending on what your nutrition looks like, what your exercise look like, what your stress levels look like, right? What your environment looks like. I told you when I moved to Chicago, the toxicity of the environment. I live in a big city now. I used to live in Florida where it's beachy, where the air is cleaner, right? So my I wasn't breathing in toxic environments. But I moved to Chicago and I started breathing in, right? I work downtown. I've worked downtown the entire time I've lived in Chicago for the most part. So if I'm not wearing a mask or if I'm not wearing something over my entire face, I'm literally breathing in the toxicity of the environment of Chicago, which when you breathe that in, it starts messing with your hormones. It starts aggravating your hormones. And that in and of itself will imbalance your hormones because it's a foreign substance that's now taking over your body and your hormones aren't used to that. So it's going to try to start fighting that off, right? And so something as simple, or maybe not so simple, it depends on whether or not you understand it to be or not, but something like that can knock off the balancing of your hormones, right? But here's what I was getting ready to say prior to that. So you have a woman who has her ovaries still, and her issue is that she just simply needs to balance her hormones. But then you have someone like me, right? Who doesn't have any hormone production in her body from a natural standpoint, right? From like your ovaries, right? We know that our ovaries is what produces the hormones in our body, the main hormones that I'm talking about. So when you no longer have that hormone production um, method in your body, then there is no balancing your hormones. I can't balance my hormones when they're not there, when they're not being made regularly. So now that goes to I need to replace my hormones. And that's where hormone replacement therapy comes into play, something to consider for women. Now, I am a huge advocate for hormone replacement therapy, especially the natural hormone replacement therapy. So I personally have bioidentical hormone replacement therapy. I use bioidenticals. I have a hormone gynecologist here in Chicago. Amazing, 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 amazing hormone specialist here in Chicago. And she administers my bioidentical hormone replacement therapy because I have to have my hormones replaced, right? I will tell you this. When I first had my blood work checked after going to her, she did the blood work for my testosterone. My testosterone level was at 15. 15, right? I was feeling horrible. I'm telling you, I was hot sweating and night flashing. Man, that's just a piece of it, but it was a big piece of mine. Like my sleep was being interrupted 3 to 4, 5 times a night because I would wake up in just a puddle of sweat that I would then have to get up and I would have to change my clothes and I would have to lay a towel out on my bed and I would have to fall asleep on the towel because I couldn't fall asleep in on the sheets because the sheets were completely wet from me having sweated, right? And that would happen 3, 4 times a night. It was horrible, y'all. I'm telling you, it was horrible. And it just came on me. And I was like, nobody prepares us for this. Nobody tells us about this. And even when I started doing the research, when I started looking up information about like kind of what I was going through, I still didn't find a ton of information on menopause. I found a lot of information on perimenopause. And it's unfortunate because that's not the issue of the women who are in menopause. Women who are in menopause don't need information on perimenopause. They're past that. Women who are in menopause, they're in something called postmenopause, right? Or menopause. It's either postmenopause or menopause. That's what we're in. And it's almost like we are a lost demographic of women because no one knows how to treat us. No one knows what to say to us because, oh, well, we'll just push them off to the side. And over a course of years, they will grow out of that and be okay. True, but for the average person, that can be 12 to 15. Like a woman could be in menopause for 12 to 15 years before she actually gets out of that. And then after she gets out of that, what? She's like 70 years old and like how much of a life does she have after that? And so I just think that in that time frame of after you come out of perimenopause, and it's two different women. It's the women who have gone through perimenopause, their period has totally stopped. Now they're in menopause, but they still have their ovaries. So to some degree, they still have some semblance of normalcy. But then you have the other women like myself who don't have ovaries. And so we're going to be dealing with this for a very, very long time. So I'm going to give you an example of what I'm talking about when I talk about degenerative. So I was just home visiting my mom. My mom had not been feeling well for a very long time. And I don't remember, depending on when you watch this live, um, my mom had to have a hysterectomy after she gave birth to me. So I just turned 50. So 50 for 50 years, my mom has not had her ovaries, right? She had to have a complete hysterectomy. So she has not had ovaries for over 50 years. My mom has not been on hormone replacement therapy. I think she might have been on hormone replacement therapy for maybe a year, a couple of years or something like that. She was telling me, but not nearly, nothing similar to what I'm on now with the bioidenticals. But my mom now is suffering from degenerative conditions. So she has stenosis in her back and she has radiculopathy in her neck, which, if you look those conditions up, those conditions have to do with the bones and the joints, right? So, one of the things that we learn with menopause is that women who are in menopause or even in perimenopause, as they're kind of progressing into that menopausal state, they have to start doing more strength training and weightlifting because their muscles and their bones become weak, right? And if they don't do, you do less cardio because cardio is stressful on the body. So back in the day, I would do cardio for like an hour at a time, and then I would go and do like 30, 45 minutes of strength training. I'm telling you, my body was solid back then. It's like when I was like 43 years old. But now I've learned that I can't do a ton of cardio because cardio actually puts, when you do a ton of cardio, like an over excessive amount of cardio, that cardio puts stress on your body, which does a reverse effect. And that stress will actually make you gain weight, right? So it's kind of a catch 22, and it's really it's horrible that you know that we have to go through something like that. But I started doing cardio, like 20 minutes of cardio is I do when I do cardio 3 to 4 times a week. I do no more than 20 minutes. I do a 5 minute warm up, and then at the end of my workout, I'll do 20 minutes. That's a far cry from what I used to do when I worked out. But I spend more time lifting weights because as I get older, my body depends on me because menopause will cause your bones to get weak and it will cause you to lose muscle. So when I talk about my mom has never lifted weights. She doesn't lift weights. She doesn't work out. She doesn't do anything like that. And so now she's dealing with a degenerative condition in her back and in her neck. And it wasn't until I was home with her last week that I had this epiphany. And I said, Mom, I said, I'm trying to figure out when all of this stuff started, like what made this stuff come with a vengeance like this. And it was like a light bulb turned on in my head. And I said, you have not had hormonal production in your body for 50 years. Can you imagine how your body starts declining when the one thing that makes our body function the way that it does is now gone? Not just for 1 year, not just for 2 years, but for 50 years and counting. My mom will be 75 this year. She has not had any natural hormone production in her body for all that time. And so that I have another friend of mine who suffers with degenerative conditions as well, and she had a hysterectomy along with the ovary removal, not long after me. And I asked her, she's been dealing with very similar stuff like my mom. I'm talking about they're like sick twins, like their bodies, they are experiencing some of the exact same things with the degenerative um, joint behavior, muscle behavior in their body. And I asked her when I saw her, I said, do you think that your conditions were exacerbated after you had your ovaries removed? And she said, absolutely. Without a doubt, she said, absolutely. And it confirmed what I was thinking about because I asked her this after I thought about it with my mom, and it confirmed. And I said, this is what menopause does to our bodies. And this is why I will, for however long I have a voice in my body, I will be a mouthpiece for helping women understand what menopause does to their bodies and to not automatically default to the doctor saying, oh, you have high blood sugar, you're pre-diabetic. The resolve for that is diet and exercise. No, no, no. The resolve for that might be diet and exercise for the average person who has pre-diabetic or diabetic um, diagnosis. But you're not the average person if you're also going through menopause or perimenopause, because those two things will 100% cause your blood sugar to increase. It will cause your cholesterol to increase. It will cause your blood pressure to go up because menopause is about hormonal declination. When you are in menopause, when you are in perimenopause, you are not getting periods on a regular basis. So when you are in perimenopause, you're not getting a period on a regular basis. So your hormones are not producing correctly. They're declining. That's the reason why you're not getting a period on a regular basis, right? When you are in menopause, you're not getting a period at all. So your hormones are not doing the work that they would normally do. So when you're that's our whole the whole functioning of a woman's body has to do with reproduction. That's how God made us. That's how God made us. The whole functioning of a woman's body has to do with reproduction. So when there is a glitch in the reproductive system, your body is going to start going awry. And that's why menopause makes women's bodies go nuts and haywire. And so I think the number one thing that I want to be committed to doing is I want to be committed to just being the mouthpiece and helping women understand to default when a doctor tells you that something might be wrong with you that isn't typically an issue for you. I'm not talking about something that has been an issue for you all of your life. I'm not talking about that. But I am talking about when the doctor says that something is wrong with you and it's not typically an issue for you, don't just default to there being something medically wrong with you from a pharmaceutical state. I want you to first always default to, I need to get my hormone levels checked. And be very careful about getting your hormone levels checked by a um just a regular medical doctor, like a primary care, because while they do, they are able to check your hormones and draw blood and all of that. They're not medically learned in like functional medicine and the types of blood tests you need, right? So functional medicine is a functional is it's a study on the holistic health of a woman, right? Here's another thing that I also want to make sure I share before I get off. So women's health from the beginning of time, it's always been about women's health. But as you get to a certain age, women's health starts becoming women's hormonal health. So that's something that I want you to always keep in the back of your mind. Up until about maybe 40 years old, it's women's health, right? everything that your body is, everything about your body is about women's health, improving women's health. But at 40 and beyond, it now becomes a hyper focus on women's hormonal health, because your hormones are almost always the direct connection to why your body might be functioning the way that it is. And that's the message that I want to always make sure that I give to people, and give to women. So as long as there is breath in my body, as long as I continue to learn, to read, to listen to lectures, to listen to podcasts, because I'm still on this journey myself. I am still on this journey. I feel 100% better of where I was. My testosterone number last time we did it was about 90 something, up from 15. So the bioidenticals, but when you do hormone replacement therapy, you're never going to get your hormones back to its original state of where it was when you were 20. But because I'm at 50, even if I was in great health, my hormone production wouldn't be to where it used to be, right? That's just a guide to what it looks like to balance, but you're never going to replace your hormone. Hormone replacement is not about replacing your hormonal functioning to where it was before. Hormone replacement is giving your body some semblance of normalcy. Who are like the best candidates for hormone replacement therapy? Um, that kind of depends, but from a general standpoint, women who, like myself, who don't have any ovaries are the number one candidate for hormone replacement therapy, because you don't have any hormone production. You don't have ovaries that are producing hormones, right? So you're the first candidate. We're the first candidate for hormone replacement therapy. The second candidate for hormone replacement therapy might be the person who's going through menopause from an organic standpoint, but that really just is on a case by case basis, because what they try to do with those individuals is the first thing they're going to try to do is see how you can balance your own hormones. So we know that there's a hormonal declination, but then there's also an issue of hormonal imbalance. And you won't know if you have a hormonal declination until you get your hormones checked by blood work. So that's why I tell women, get your hormones checked every 6 months or every year. Get your hormone levels checked, get blood work, and then make them tell you what it is. Best doctors to go to do that are functional medicine providers, not regular medical providers, because I mean, unless you get a really great gynecologist, but then you want someone who is an expert in hormonal medicine, right? So fortunately for me, my doctor here, my gynecologist, is a hormonal specialist, and she's a godsend to me. So I don't even know if I was able to touch everything that I wanted to touch on tonight, but this was definitely a conversation that I want to have. And it's a conversation that I think we need to have more of, because I think the problem in the past has been our parents have not been able to share anything with us because they never had the conversation. And so we don't want to keep passing this down from generation to generation where nobody's having this conversation, and we have our 20-year-olds and our 30-year-olds living their best life right now. But in the natural progression of life, that stuff is going to come to a halt, right? And we don't want them to be as surprised as we were when we went through something like this. We want to be able to share, and we don't just want to share something as surface level as, girl, watch out for those night sweats and those hot flashes, because that's the big thing. No, in all honesty, the night sweats and the hot flashes are just a small symptom of the bigger picture, right? When you are in menopause or perimenopause and you get the diagnosis that you are pre-diabetic, and that's not something that's not something that's typical to you, or when you get you have high cholesterol, you need to go on medication, or you have high blood pressure, you need to go on medication. Before you do any of that, before you do any medication, anything like that, the first thing that I want you to always default to is, Okay, doctor, that's fine, but I want to get my blood work done through my functional medicine provider because I really want to see where my hormone levels are. And if your hormone levels come back to be incredibly lower than what they normally would be, get those hormone levels up and get them treated, because by default when you get those hormone levels treated and brought up by balancing or whatever the treatment plan is going to be, guaranteed, I'm telling you what I know, I did not have to go on any medication to get my blood sugar number down. I worked on my balancing of my hormones and the replacement of my hormones. And when I started, the last time I went to um, a couple times ago when I went to my hormonal doctor, she was ordering my blood work. I said, "Can you also run a blood test for my A1C?" And she did, and my number had come down to 5.6, which took me out of pre-diabetic. I didn't have to get on medication for that. That was because I was working on my hormone levels, and my hormone levels, the menopausal effect and the declination of my hormones was the real culprit. And so the message that I want to get to the women here is always consider that your hormones may be the real culprit, not necessarily the declination of your health. It's the hormonal health that might be the real culprit, not necessarily the health of the woman. All right. So that's really all I wanted to talk about tonight. Hopefully, we can have more of these conversations. I would actually love to have like a um, roundtable of sorts, to have this conversation more with women, because I just want to be a catalyst or just a safe space for women to be able to talk about what they're experiencing in their bodies and get some insight around how to better your health and how to get yourself checked out for that. So hopefully we can do that. But anyway, that's all I wanted to do. I do purpose night. I'm sorry. I do Thursday night purpose talks every Thursday night at 8 p.m. Central to 9 p.m. Central. I will be streaming here to my Facebook page, my YouTube page, and on Instagram Live. So definitely check me out on any of those three platforms on Thursday nights at 8 p.m. Central. So, all right, I'll see you guys next week. Bye.